The Recovery and Stay Well Plan. The Recovery and Stay Well Plan provides a framework to assist GPs in working with patients with mental illness to review their care and promote recovery in a community setting. The page of the template includes 4 free text boxes to enable GPs to document their discussion with the patient on 4 key questions. These boxes are signs of becoming unwell, anticipatory care plan, patient's goals and priorities, and health action plan. Questions you may wish to ask in each section include the following. Under signs of becoming unwell, this is inquiring how we would know that the patient was ill again. For example, how would you know you were becoming unwell again? Can you recall the last time you were unwell? How were you feeling then? Were there any clear triggers that caused those episodes? For the anticipatory care plan, consider what has previously helped you to recover. Would you need medication, psychological therapy, support, or even hospital admission? Under the patient's goals and priorities, we are trying to find out what feeling better would look like for them. How would you know you were feeling better or recovering? What would you like to be different about your life? What are your ambitions for the next year? This is a general, more philosophical inquiry, but then needs to be broken down into details of a health action plan. Ideally, this should include a number of actions that the patient agrees to undertake within the next year. Discussion around this might include, how could we make this recovery plan achievable for you? What would be a realistic target for this year? What actions are you going to take? How can we support you with these? In completing these sections, reference should be made to the patient's SwanWeb's questionnaire results, which may indicate areas to develop as part of their recovery, such as their social interaction. Reference may also be made to the physical and social data collected on page 2, which may indicate areas of concern, such as obesity, housing problems and lifestyle factors. Try to always make goals specific and measurable, but also attainable for the patient. We will now show 2 worked case examples to indicate how the template may be used. The first is a 28-year-old male with bipolar 1 disorder who is open to secondary care. He has suffered episodes of both hypomania and depression, and with encouragement is able to identify signs and symptoms of both. He identifies symptoms of his hypomania, including starting to not sleep and staying up all night. He often feels invincible, that he could conquer the world, and has racing thoughts that he's unable to quiet, and turns to increasing drug and alcohol use to quieten these. He identifies that these are often triggered by episodes of erratic lifestyle, such as when he has been to festivals or has been travelling. Unfortunately, his higher moments quickly dissipate and are followed inevitably by episodes of depression. During these, he sleeps to excess and lacks the motivation to get up and get to work. Eventually, as his mood worsens, he has suicidal thoughts, though has never made any attempts at suicide. Under the anticipatory care plan, we discussed the medication that the patient's taking, in this case lithium 800 mg and olanzapine 5 mg daily. When he is compliant with this is working well, in combination with clonazepam PRN if he starts to not sleep in order to prevent relapse. The patient also identified that he needed to avoid drug and alcohol use to remain well, though if he became unwell, brief admissions were often needed in order to stabilise things again. Next, we discussed the patient's general goals and priorities. What would feeling better look like for him? He identified that his main priority was to avoid hospital admissions in the future, as these are very disruptive to his life. In line with this, he would like to keep his job and reduce the impact of his relapses on his partner. From his physical health check, we also identified that there was a danger of weight gain on his olanzapine, and he wanted to avoid this too. To create the patient's health action plan, we translated his general goals and priorities into a number of specific targets. Number 1, Attend a course on managing bipolar disorder at the Recovery College with your partner to help recognise your triggers and early warning signs and know how to manage these, particularly by maintaining a regular routine. Number 2, do a mindfulness course with Mind to help manage your racing thoughts. 3, limit alcohol to 14 units per week, particularly with none on work nights. Number 4, avoid drug use, especially when away from home, as this is your most vulnerable time. Number 5, increase your exercise. The patient agreed to go to the gym 3 times per week. It is important to tailor the patient's health action plan to their ability to action them through the year. A more able patient will be able to cope with more demand. These can be reviewed the following year to check on progress. Here is another example of use of the template, this time with a 53-year-old female suffering from schizophrenia who is open only to primary care. On discussing her signs of becoming unwell, she identified key issues were not sleeping, thoughts that strangers on the street were starting to talk about her, voices saying that she was evil, eventually starting to isolate herself, stopping going out or seeing her daughter, and when most unwell, beginning to shout at people in the street. On discussing her anticipatory care plan, what had kept her well, she said that she'd been very stable for many years, taking risperidone 6 milligrams daily, though was experiencing some involuntary movements and twitches on this that embarrassed her, and also felt very sleepy during the day. Her last hospital admission had been 20 years ago. On discussing the patient's goals and priorities, and what would feeling better look like for her, she was able to identify that she'd like to be able to do more and not need to sleep in the day. She would also like to reduce her weight, especially as she was now pre-diabetic. However, when we discussed socialising, she felt quite ambivalent about being able to increase this. We then discussed how to turn her goals and priorities into a health action plan. These were listed as below. 1. I would refer her to the primary care mental health team consultant for a medication review to consider reducing her dose of risperidone. 2. She would restart procyclidine 5 milligrams 3 times a day for her movement problems. 3. She would try and cut out fizzy drinks to help reduce her risk of diabetes. 4. She would try to walk somewhere every day and take the stairs to her flat to increase her exercise. 5. I would refer her to a befriending service to help her go out more and attend a cookery course at the Abbey Centre. Generally, it's recommended to print off a copy of the Recovery and Stay Well plan to give to the patient. That way they can keep a track on their progress against the health action plan. However, this may not be appropriate for some patients who lack insight into their condition or are unable to read English, so the KPI against this has been set at 50%.